So first and foremost, can you tell me your name, spell it for me, and your position with MMHD?
Yeah, hi, my name is Liz Braddock, and I'm the health officer with Mid-Michigan District Health Department.
Okay, all right, perfect. So the state's coronavirus numbers came out yesterday. And on Wednesday, we were seeing about 13,000 average cases a day, and now we're up to 20,000. So I guess when you heard that news, first and foremost, what was your reaction and how did that make you feel?
So we know that Michigan is in an area of high transmission. Our case numbers have gone very high this week. It's a result probably of people traveling over the holiday or maybe doing some gatherings. So now we are concerned that these numbers are going up, and I feel that the residents of Michigan, we do need to do our part to make sure that we can protect those who are vulnerable and immunocompromised. And I would encourage those who want the vaccine to get boosted if they've had the 2 initial doses and are now 6 months after those 2 doses, they should consider getting the booster.
Okay. All right, perfect. And so just for me individually, when I hear 13,000 a day, jumping to 20,000 a day, so that's adding on to the 13,000 that we already kind of have, it kind of puts me in a panic just as a personal person. Just as an individual. So is this a time to panic? Is this a time to be more concerned? Is this a time to take extra steps to make sure that we're safe? Like, what can people do? Because this is a little bit alarming. I know for me personally.
Since we obviously have community transmission, I believe people need to be more vigilant, need to be more aware of what they are doing day to day. So for example, if you're going into a location where there is crowded areas or you're unable to maintain 6 feet separation from somebody you don't know, you should consider wearing a mask. There's a public health advisory right now in Michigan that says you should consider wearing a mask when you're inside. Mask will protect you from any Delta or Omicron variant, so we should consider wearing a mask when inside. Also, the vaccine does help, so we would urge those who have not had the vaccine to consider getting the vaccine, and those who have not had the booster yet to consider getting the booster shot if it's been more than 6 months since their initial 2 doses.
Okay. All right, perfect. So there's a lot of people out there who are against the vaccine and things like that. So for those who are against it, what other precautions can they do to make sure that they're extra safe?
If you're ill, you should stay home. If you have been exposed to somebody who lets you know that they have tested positive, you should consider staying home, not attending work, not attending school, or switching to remote. And again, masking does help stop the transmission of the disease.
Okay. We've been in this pandemic for the past 2 years, probably a little bit more than that. Being in your position, I guess, how has that been for you from the start until now? How has that affected you? What are your thoughts so far just on being in this position for so long?
It's been a big strain on public health, but we are doing the job that we like to do and we want to do, which is to protect the public and protect them from illness and make the public aware that there are infectious diseases out there and that they can take precautions and do some certain steps such as vaccine and immunization to protect them. We didn't anticipate that we'd still be in a pandemic that's so far away from March 2020. So I hope that we can all work together here in Michigan and in our community here in Greater Lansing and Clinton County to do these small steps to prevent further transmission and to see if we can get to the end of this pandemic.
And you mentioned, you kind of emphasized the fact that we have been in this position for a long time. Do you see an end coming to this? Because every day there's a new variant, every day it's just something new when it comes to the virus. So I guess, do you have any hope or that this will end sometime soon?
So right now, the tools that we have to fight this new variant includes the vaccine. And we didn't have the vaccine when we started this, a year and a half ago. So if we can use all the tools that we have, I anticipate that we will get through this high transmission right now, and that our case count will eventually come down. And I do hope that does happen very soon.
Okay. And what do you think is the cause for such a high uptick in cases within the past few days?
I think we're coming off a holiday where people have maybe not been doing their usual, not being in their usual situations. Maybe there's been an increase in travel, increase of people meeting families and doing some social activities. And that can sometimes cause the spread. We also see people coming into Michigan, visiting Michigan, visiting family, and they may also have brought in COVID. Unknowingly to them, they may have brought in the disease and the variants when they were visiting Michigan.
Okay, all right, perfect. Is there anything else that you'd like to add that I didn't ask you?
I think I would like to add that we have information on our website, which is www.mmdhd.org, about isolation, quarantine, where to get the vaccine, and also where to get testing.
Okay, perfect. And are there any tools or any other things that you guys are doing to kind of boost either vaccination or just information about COVID, or just trying to reduce the cases that we have now?
We're just encouraging people to quarantine if they've been exposed, and to isolate, stay home if they have been infected with COVID-19, and to make good choices when they do go out to the community and consider wearing a mask.
And then what about just COVID fatigue? People are tired of hearing about COVID. People are tired of having to quarantine. People are just tired of COVID in general. Do you have any thoughts, any words of encouragement, anything to say to any of our viewers who are kind of just dealing with this? Because I think we're all kind of just tired.
I don't have anything to say. I wish we weren't having this conversation. I wish we were in a better situation, but we just need to be vigilant, be aware that we are in high transmission, be vigilant, and to make sure that we do our part to stay healthy and to protect those who may be high immunocompromised, or may be more likely to be susceptible to disease and illness.
Okay, and last and final question, is this, because of the cases increasing so rapidly, is this the time to take more precaution now more than before?
Our messaging is that we should be precautious of what we are doing. We should be more aware, and that we should just be more vigilant that there is illness in the community, and there may be people who haven't been tested and may have contracted COVID-19. So it'd be best that we just be more vigilant. And as I've mentioned, wearing the mask does protect you if you are in close contact with people or in crowded locations.
Okay, all right, perfect. Those are all my questions that I have for you. Is there anything else that you'd like to add that I didn't ask?
No.
All right, perfect. Thank you so much for your time. I really appreciate it.
Okay, bye-bye.
Bye.